am glad to be here, though, actually. I'm glad to be talking to all of you about our new advances in Alzheimer's treatments. How many of you here today know someone with Alzheimer's or dementia? I don't know why everybody's here, huh? You know, even the people that sometimes don't raise their hands because they haven't, and surprisingly, I still run into people that don't know anybody that have Alzheimer's or dementia. I tell them, wait another week. You'll meet somebody that is affected one way or another. And it's the sad thing in our world right now with this disease is that it is progressing fast, but it is progressing quickly because it affects mostly people over the age of 65. And our population of aging is growing. Okay, did y'all know that by the year 2050, so I know that feels like a long time away, but it's not all that long, there will be 1 in 4 people in the world will be over the age of 65. 1 in 4, and if right now we have 1 in 3 people know somebody that's affected by Alzheimer's and dementia, can you imagine in 25 years if we don't do anything to stop this disease right now, what that statistic's gonna change to with the population being even higher for people over the age of 65. And so that is where we have been pushing as an association so much. The research, the advocacy, the funding, and the education on Alzheimer's and dementia. And that goes from knowing how to recognize it, what the signs and symptoms are, versus regular aging, all the way to healthy living for the brain and body. And then also, you know what, how to communicate with those that have Alzheimer's or dementia. Has anybody here ever tried to talk to somebody, like have a real conversation with somebody with dementia? Yeah? Is it easy? Is it awkward? Yeah, most people want to fill the gaps of silence or answer the questions for the other person that's affected because they don't want them to have to sit there and feel awkward. But you know, if you guys take a breath and just give them a few more seconds, even up to maybe 60 seconds, a lot of times, thank you, they will come up with an answer for you. And you don't have to worry about answering it for them. And so that's just one little tidbit I'll give you right now. Welcome guys, come on in.
Front center, yes.
Absolutely. So, question, on the realm of research, how many of y'all think that we have a cure for Alzheimer's or dementia right now? Is there a cure out there?
I wish.
You wish? All right, yeah, I wish too. Do we know what causes Alzheimer's or dementia yet?
Sort of.
A little bit? Assumptions, yeah, thoughts, theories, practicums, yeah, you're absolutely right. There are some thoughts and theories, and we are finding more and more ways that are our best chance of preventing it. We do not have a 100% route yet, okay, but we do have some good info. You talked about wanting to know some of the ways to prevent it, and without going into a whole educational on ways to prevent it, I will tell you the one thing I would teach you tonight about healthy living for the brain and body, just the one thing, because we're gonna go more into research, is what's good for your heart is good for your brain. Simplest thing I can tell you, because 1/3 of the blood that pumps through our heart goes up into our brain and back around down into our heart, which means that's what's oxygenating our brain as well and keeping the blood flowing in our brain. And so if you will protect your heart and that blood flow, cholesterol, low-fat diets, you want to have more proteins, you want to have a Mediterranean style diet, things of that nature, and cardio exercise above all else. Cardio exercise, even if it's just a little. I mean, you don't have to go run big marathons, y'all. Just do a little bit a few times a week, and that will change your life dramatically as far as possible prevention. So that's your little short tidbit on healthy living for today. So, what is the craziest thing y'all have ever seen on Facebook or Google or on the news about what causes Alzheimer's?
Diet Coke.
Diet Coke, okay, yeah. Anything else, people? I'm I'm sorry?
Bananas.
Bananas? Okay, you've heard that, really? That's a new one for me. Alright.
Dr. Pepper.
Dr. Pepper, okay, alright. Diet Coke, Dr. Pepper, and bananas, I'm not eating. Together anyway, for sure. Well, I'll tell you what, we hear and see all this hope and all these things get put up because we're in an age of information right now, guys. We're getting bombarded in all aspects of our lives right now with information, and it can get scary. And I will tell you, if we are to look at every single thing that comes out that is gonna cause us to not have Alzheimer's or dementia, we're gonna be like, what do we eat anymore then? What do we drink? What do we put on our bodies for lotion or shampoo or soap? And what do we do for chemicals to clean? You know, it's gonna be like, oh my goodness, it's overwhelming. It is absolutely overwhelming. So I will tell you, until it comes out from the NIH or from the Alzheimer's Association, all right, don't expect that that is a true cure or answer for Alzheimer's or dementia when you hear things out there, okay? You can always go to alz.gov or to the NIH, and you can look and see if that is confirmed before you start acting on whatever advice that media is giving you, okay? And that way you'll have a safeguard and you don't have to fret as much. So research right now has been focused in large part on getting the FDA to approve treatments on some new drugs that are out there. Do you guys need to speak?
She's got it.
You're good, okay. Some new drugs that have been coming out there, and one thing that we do at the Alzheimer's Association is we also advocate. We advocate our representatives in Congress, both at the federal level and the state level. We go to Austin. We have a whole day where we walk around to all of our representatives and talk about what is being presented right now for Alzheimer's funding or for bills that would help us pass more training, so to speak, more knowledge, education, requirements and such. We do that in Washington, D.C. once a year as well. And we go around to our representatives and talk to them about the different asks we have and what's gonna be presented on the floor at certain times and how we want co-sponsors, and we go and we push for this. And I'll tell you about some of the ways the research I'm gonna tell you about today coalesces with current advocacy and current bills that we are pushing for in Congress right now, that we can't get farther with funding for it. We can't get it paid for by Medicare or Medicaid unless we go and we get congressional approval on very specific things, okay? So today I wanna go over some of the learning objectives that we have is gonna be to list the FDA approved treatments right now for Alzheimer's. We're going to talk about the impacts of anti-amyloid treatments on the brain, very specifically anti-amyloid treatments, and their benefits and side effects. We are gonna talk about pathways to access the treatment and where you can go. And then also we want to be able to describe the resources available through the Alzheimer's Association to assist in that access. Hi, welcome.
Thank you.
So today, 7 million guys, nearly 7 million people in America, only America, 7 million, have Alzheimer's, okay? And there are over 11 million people that are taking care of people with Alzheimer's. I find this statistic very interesting, how it's gonna impact us coming and moving forward, especially in our workplace. We have about 1.8 caregivers are needed to take care of each person that has Alzheimer's in America. 1.8, so not just one person. And I'm talking, you gotta rotate it, right? Because you get exhausted. And mind you, you're working a job at the same time. You're taking care of kids. You're taking kids to soccer games and practices and school events at the same time too. And so it takes having a team. It takes having a partner, and a lot of people don't have that. So with that, jobs get interrupted. People have to call out sick. People get distracted during the middle of their work because you know, their loved ones at home calling, like my mom does, and she knows I talk about this all the time, and she does not have dementia right now, but she always thinks she does when she can't find the remote control, or she can't get the button to work, and she's like, and she did today too, she texted me, Jenny, YouTube, I'm having to use your sign in because mine for some reason keeps thinking I'm traveling and I'm not, and what do I need to do? And I'm like, I am 2.5 hours away. I'm so sorry, just keep using my username and password, please, because that's easier right now to figure out. So, I mean, when you get those calls with somebody with dementia, it's gonna be repetitive throughout the day. And then it's gonna be, because a lot of them, the television during the day is one of their only things they get to do, you know? It's one of the things that keeps them busy when they're stuck at home and they can't drive anymore and they can't go out and they're living alone and you're at work. So you get interrupted a lot. And so that is another way that this disease is gonna end up affecting our economy as we continue to go, as well as the growing amount of people over the age of 65 that keeps coming. So the treatments that we're gonna talk about today are gonna talk about slowing down the progression of Alzheimer's specifically. Hopefully slowing it down or freezing it in its place. Has anybody here heard anything specifically about the new amyloid fighting drugs? Leqembi, I always pronounce them wrong, I'm so sorry. Leqembi is one of them, and Consuela is another one that is out there that we'll talk about. But one of the biggest things is early diagnosis for these drugs, okay? And we'll keep talking about that as we move forward here. So, Dr. Alzheimer is actually the name of the person that discovered Alzheimer's, by the way. And so he first really put a description together of this disease back in 1906. So it's still fairly new as far as what's on our radar, but as far as other diseases that have come up, they have been around just as more recently as this, and they've made a lot more progression. And when we're talking about advocating and going to Congress, we're also talking about why are some diseases given more preferential treatment than others? You know, as far as what kind of funding will come for those diseases or how they will be paid for by Medicare or Medicaid at the same time. So in 1996, we had donepezil come about, and that is Aricept. Aricept is something that's going to help with symptoms, okay? There are a couple different categories when it comes to these drugs, and some of them are only gonna treat symptoms, and then others are gonna slow the actual disease progression. So, and then there's a couple on here that we'll talk about that have to do with mood and behavior, and particularly insomnia, which is a big issue for people with Alzheimer's right now, going on, along with other behaviors. So, with donepezil, it is for symptoms. So what are symptoms of Alzheimer's? Anybody throw out some symptoms that you might see as an effect?
Can't remember where your remote is?
That's a little cheating, I think, but hey, way to pay attention. So. I didn't have candy to throw at you, but I would if I could.
Forgetfulness in general.
Forgetfulness in general, yep.
I mean, where do I park? How do I get to the grocery store? When they've done it 1,000 times.
Yep. So outside of the memory, does Alzheimer's affect anything else? Yes, ma'am.
Well, I think it makes you lose vocabulary, you lose consciousness of things that you used to know, like a cup is
Right.
a what? So,
Yeah, absolutely. Well, you know what, also, if you think about it, it's not just a memory disease, although that is the biggest symptom that most people do have, but it is a brain disease. So it causes your brain to stop working appropriately. And so it will affect knowing whether you should eat or not because you don't remember, some people don't remember if they did or didn't eat, but others, they just don't get hungry anymore. And so you'll start to see people as they progress through the disease get smaller and smaller and skinnier, and you just think that they're like a twig you could break, right? Well, they don't remember to go eat because they don't feel like they need to eat. Their brain's not telling their body to go and get nutrition and get fuel for it. And then when somebody tries to push it on them, I'm not hungry. I mean, if you're not hungry, do you want somebody making you drink stuff, making you eat food? Like you want to just say no. And so, and also your brain stops telling your body how to fight an infection as well too. As it progresses even farther, it can stop telling your kidneys, your liver, your lungs how to work properly. And so that is what causes the body aspect to start being affected and dying off as well versus just the memory in that sense. So just keep that in mind too. So that is a big part of the symptoms. So with the symptoms, these medications are the ones that are most used to treat, and that's donepezil, which is also, that is the generic name for it, by the way. Aricept is the brand name. Okay, I've got the actual pronunciations here. Rivastigmine, that is not one that I use often. I would say Exelon normally because it's easier of the words. And then you have galantamine, which is Razidine. And then you have memantine. I think that's one that I see the most in my line of work that is used so frequently. And then there's, of course, Namzaric, which is memantine and donepezil used at the same time. Okay, it's kind of a combo drug effect. Now, these can be used all the way up through moderate dementia, almost into severe dementia on a couple of them, the memantine or the Namzaric. Once you get into full severe dementia, it's not gonna make an effect anymore. And so, don't be surprised if doctors start taking you or your loved ones off of that medication when you're kind of getting into late stages of this, because it's just, there's no reason to keep having to swallow pills. Another side effect, the throat can't swallow things as well. Okay. So, when we look at Leqembi or we look at Consuela, those are gonna be ones that help to slow the progression of the disease. Now, you'll notice when these drugs are given, they're given for MCI and mild dementia. Does anybody know what MCI is?
Mild cognitive impairment.
Yes, ma'am, that is right. So that is where your memory is starting to have an issue, but it is not developed into known Alzheimer's yet. So you are just having issues here and there at this point, just here and there issues. And maybe you're still able to drive, you're still able to work, but things are getting noticed. And when you go in and do a cognitive assessment with your physician, you might be scoring a little bit lower on that test. And some of the most basic tests say they're gonna be a score of 30 typically, and if you don't score higher than 26, then you're in some phase of mild cognitive impairment down to severe dementia already, okay? So you can see that as 30 being 100 on the test, and the more you go down lower, the farther progressed you likely are, okay? So you have to be an MCI or mild dementia to have any effect with these drugs for them to be helpful of any kind. And that's why they're given during these stages. Mild cognitive impairment will not always turn into Alzheimer's, and that's the hope, is that we can freeze it and stop the progression while it's still at mild cognitive impairment. Anybody that has Alzheimer's had mild cognitive impairment at some point. Okay, so anybody with Alzheimer's has had MCI, but not everybody that has MCI has to have Alzheimer's. If we can get the research going and get these drugs better and better and better. Right now, 12% of people are seeing the progression slow or stop, all right, with one of these two drugs. 12% doesn't seem like a lot, does it?
No.
Used to be 0, y'all.
Yeah.
But if you're one of the 12%, it's good.
Yeah.
Get on, absolutely. And you know what, I do have, there are some people that work in advocacy with us in the chapter that are on the Consuela right now, and they are seeing a massive effect from it right now. And so it's encouraging to actually see firsthand some of the people that are getting a good effect from it, and it does give us hope. And that is why we're running into the era of treatment versus only research right now. So, but those two will go hand in hand. So, Alzheimer's is a complex disease. I want to talk to you guys about the tau neurofibrillary tangles and the beta amyloid protein plaques, okay? And some of this, forgive me guys, some of these things I'm gonna read a little bit because I do want to make sure I'm getting it just precisely right, because sometimes when I go off of my own memory, I develop my own words added in here and there, and sometimes they're not just right. So with tau neurofibrillary tangles, okay, it's a protein. It helps keep the brain cell healthy and allows for nutrients and other essential supplies to move throughout the cells. But guys, in some people, those tangles, that protein, they get tangled up and twisted, and it cuts off the supply of those good nutrients, okay? And so, as we're looking at this, then you add into the beta amyloid protein plaques, all right? The amyloid plaques, you can see on the end here, you've got the nerve cells up top, and then all those little bitty clumps of things are gonna be your amyloid plaques that are gathering together. They come together, they clump, and they form amyloid plaques. It's all the beta amyloid proteins just kind of coming together. So they're not moving around freely, right? They're developing more and more. And that contributes to the cell death and the tissue loss that you'll observe often when you're having those brain scans that go through. If you have Alzheimer's, you'll see a lot of shrinkage in your brain cells. And that can be very visibly seen. Ultimately, the brain cells get destroyed, eventually impacting the person's ability to function, okay? So, what do these two drugs do? So when we wanna look at the Leqembi and the Consuela, these two treatments here, we look at anti-amyloid monoclonal antibodies, and then we're also gonna talk about who the treatment might be appropriate for on these. And when we look at the anti-amyloid monoclonal antibodies, which is a tongue twister, guys, they're gonna be the first treatments that are gonna address the underlying biology of the Alzheimer's disease. So it's not a cure, all right, but it is tackling the base, all right? It's tackling those plaques that are growing together into clumps, the amyloid clumps. The amyloid aspect of this is what the biggest piece of information they've been able to find and tie together. I once heard, and this is one of those things I might be making up a little in my head, so forgive me and double check everything, okay? Is that with the plaques, the amyloid plaques, and then the tangles that go through, the plaques coming in and growing like that are almost like the top of a match head. And that is there, but until that match head is struck, it doesn't flare up and start to affect the cells. So as it's all clumping together, those two things strike up and catch fire and start to spread, and with the shrinkage coming, all the cells comes around in it. So the amyloid plaques are a fire starter in that sense, okay? And so with these drugs, the treatments work by attaching to and then removing the beta amyloid from the brain. Each works differently in the target beta amyloid at a different stage of plaque formation. So the clinical trial participants who received anti-amyloid treatments experienced reduction in cognitive and functional decline, meaning these treatments slowed the disease process. And I'm just making sure that wasn't mine, guys. And then also, we were able to show evidence that the buildup of the amyloid plaques in the brain, the treatments are appropriate for people in mild cognitive impairment or mild dementia stage, and also that have evidence of the buildup. So how do we find the evidence, guys? Anybody had to go and look at a scan before? No?
Is it dark?
The scan, it's gonna be, you either can go and have a lumbar puncture and have the cerebral spinal fluid tested, or you can go and have an amyloid plaque scan, a PET scan, okay? An amyloid PET scan is what it's called. And those are the two things that can show you if there's amyloid's presence there to go and start to take these two drugs, okay?
So I heard that there was a blood test that you could tell if you were predisposed.
Are you getting ahead of me here a little bit?
Done her homework.
I like like that you know that. But no, I'm not actually gonna cover the blood test, but the blood test I was gonna talk about later. So let me go into that because that is something I do want everybody to know that we're talking to Washington DC about right now too. So I'm gonna get into that, I promise you.
Can I ask you another question?
Yes, you may?
So I assume this doesn't happen with your primary care physician. Is this a neurologist or what's the provider that we need to see to get those things tested?
Okay, that's the problem, is we don't have enough neurologists out there, guys, right now. There is a huge shortage, especially ones that specialize in Alzheimer's disease. And so, primary care physicians, if they had access to that blood test,
Well, there's also a shortage on your, if you look in your insurance booklet, there's a shortage of gerontologists.
Yeah.
yes, there are. Yes, there are. Both of them, very big. So the neurologists are the ones that would actually typically order these tests, whether it's gonna be the spinal tap or it's going to be the amyloid PET scan, okay? Now, some of the trouble that comes into is we have to wait for those appointments, and do you know the average wait time right now is 6 to 9 months to get into a neurologist, all right? So with that, we lose precious time.
Right.
Okay, and not just on Alzheimer's, but dementia in general, and knowing where a starting treatment point is, because so many doctors and the primary care physicians, they don't have enough knowledge on anything but the basic medications, which is great, but we need them to also be trained as a primary point of contact to be able to start some processes. So one of the things that a lot of people will do out there, I've started a program as a strategist where I go out and I do cognitive screening separately. This is nothing to do with the Alzheimer's Association, I want you to know. But we want to find people that can go out and actually, non-medically, go and get a baseline, kind of like some of the tests I've talked about, and put together some reports that can go back to a primary care physician so that they can have a baseline and they can start putting together a team and maybe not miss out on all of the timeline, okay? So there are some outside of the box ways to continue and go and try to get started on items, but the testing will have to be done through the neurologist. And even then, sometimes the neurologist starting a medication, and puts in a request for the testing, for the prior authorization from the insurances, especially if you're under the age of 65, you're not on Medicare yet, and you have younger onset. Getting them covered becomes another task because you haven't had some of the tests yet, but you can't get the tests unless they're prior authorized, and it just becomes a big loop, it becomes a big circle.
Just referring back to that test or the cognitive test, where you wanted to score a 30 or whatever, is that test through your primary physician, or is that available like online, or
Yeah,
where is
so
that
there are
available?
some self-tests that you can do online, if you look them up, and I believe ALC.org does have one on there as well. But your physician should be able to do it, and we're encouraging everybody, that is 55 or older to start getting a cognitive assessment at your annual physical every single year, guys. And that way you have a baseline starting early on when your brain is still healthy, so that you can see as any progression's coming about and catch it early enough. Cause if we aren't getting it at mild cognitive, or the MCI, or at the mild stage of dementia, you can't take the drugs, they won't even authorize, they won't prescribe them, okay? And Medicare won't pay for them at that point if you're progressed past that mild stage. Cause it is an expensive drug at the same time. But cognitive decline, guys, is gonna be your memory and thinking. And I want to go over the functional decline too. Who's heard the phrase activities of daily living? Yeah, well, several of you have, okay. So that's bathing, it's toileting, it's dressing, it's taking your medications at the right time, the right ones, it's eating, it's making your meals, it's your activities of what you have to do to live daily, okay? Certain tasks. So, unfortunately, as your brain is diseased more, it affects the functional capabilities too. And with that, it becomes, harder and harder to know the right way to dress. So you might see some people come out in, their pants with their underwear on over their pants, you know, or undergarments on over it. And no, not just for fun, guys. Cracking up back here. But you know what? Some people will put their shoes on and then start to try to put their socks on and be like, wait a minute, what happened here? I can't do that. I actually have a client right now that is one of their big things. They always put their shoes on first and then they want to do their socks like you. So that's a functional decline, guys, all right? Can you still survive? Can you still live life? Yes, but it's an issue. So these outcomes from these two medicines early on can do a reduction in cognitive decline and then also reduction in the functional decline. And so they say possibly freeze it where you are. Now mind you, if your MCI or your mild dementia gets frozen where it is, doesn't mean it's gonna get better, alright? You're still gonna have some decline in impairment.
Just a quick clarification on, because I hear the word dementia and Alzheimer's.
Yes.
Are they two separate things?
Thank you for asking that. I have been using those interchangeably, haven't I? So dementia is an umbrella term. So if you think of the word color up here, but then you've got red, blue, white, black, you know, all under it, it's an umbrella term for all of the different kinds of colors. So dementia is an umbrella term for all the different types of cognitive impairment, okay? So you have Alzheimer's, you might have frontal temporal lobe, you have Lewy body, vascular, and quite a few other ones. And then you'll have mixed dementias as well. Some people have a couple kinds. Isn't that helpful to think about? So, but thank you for asking that, because I've been using that interchangeably. These drugs right here are gonna be for Alzheimer's. And so you'll have to have the ability to show on the scans or through the cerebral fluid testing that amyloid plaques are there in that system to qualify for it. Okay? Side effects. So with that, you might have amyloid-related imaging abnormalities with the treatments. You might get headaches, possibly have a fall, or maybe some infusion-related different reactions in that sense. Now, not everybody has all of them. It's just like any drug. You might have some side effects, and other people might not have any.
What's an infusion-related reaction?
Let's go into that right here, okay? So it's one of the ways that this treatment is administered, okay?
Oh.
Yep, so IV infusion is where you sit there in a chair for a while and they have the drug hanging up, and it might take a few hours, and just depending on how fast they wanna run it through, and it comes in through an IV port, okay? And with Leqembi, it's done every 2 weeks, and Kinsula is every 4 weeks, okay, in that sense. So when we look at the ARIA, okay, and that was the amyloid-related imaging abnormalities, it is a common side effect, but it usually doesn't cause symptoms that are super serious, okay? It's gonna be some possible swelling, like temporary swelling in some areas of the brain. Some people have some small spots of bleeding in or on the surface of the brain. It usually resolves over time, which is good when you have a side effect, you know, if it gets in your system, it starts to go away. But most people that have the ARIA do not have noticeable symptoms. Most people will have more of the headache, the dizziness, and nausea, confusion that come with it during that time. So, and this is one of the parts I wanna read, is that some people carry a gene called the APOE4. That's like some scientific top stuff here. It may cause an increased risk for the ARIA aspect of the side effect, okay? So the FDA recommends that genetic testing for APOE4 status should be performed prior to initiation of the treatment to inform the risk of developing ARIA. And so prior to testing, doctors should discuss with the patients the risk and the implications and suggest genetic testing too, just so you have all the facts. Okay. So, also it can, the infusions can be done, mainly they're done at hospitals and infusion therapy centers. I haven't not heard of anybody doing these at the home or anything like that at this point, but How great would it be if at some point they could be done at home, kind of like dialysis is able to be done at home now on these dialysis machines? Who would have thought that could be done at any point in time? So, all right, candidates for treatment, we've already gone over. You've got to have the buildup of amyloid plaques in the brain, or mild cognitive impairment, or mild dementia due to Alzheimer's. And accessing treatment is gonna be gaining that diagnosis of MCI first, or Alzheimer's or mild dementia due to Alzheimer's. Confirm the amyloid plaques, and then possibly refer to a specialist as well to determine if these treatments are appropriate for you. And have a lot of patience. A lot of patience and waiting. Continue to live life, guys, during the waiting. So many people get so afraid, they freeze up and they stay home and they don't know what's gonna happen, and fear takes over. And you've gotta force yourself or force your loved one to keep going about your normal daily routine until you can't. Okay? You don't have to decide when you're gonna stop. It's like when you can't, you'll know. Or your loved one will know, and they'll tell you about it. So if you don't have a diagnosis, then we do encourage you to learn the 10 warning signs of Alzheimer's disease. Visit with your doctor, share concerns, get a diagnosis, and again, you may be referred. Guys, don't be afraid to tell your doctor bad things that are going on with you, especially when it comes to your mind. Everybody thinks, oh my gosh, they're gonna take away everything in my life at this point. No, not at this point, okay? They're gonna take my car away from me, my kids are gonna come in, they're gonna make me go to the home, live in a home, nursing home. No, there's so many things right now that have advanced. There are no typical nursing homes really in our area anyway. You get out in some more rural areas, you'll find some old school nursing homes, but they're wonderful places right now if you absolutely have to have it. But guess what? There are coverages now through Medicare and Medicaid that even assist with home care. People to come into the home for a period, so you can stay longer and longer in your own home now. And if you don't tell them that you're struggling and you try to hide it like most people do, guess what? You're wasting precious time transitioning through MCI, through mild to moderate to severe, and once you're past that mild, you can't get the drug, guys. So if you're not forthcoming with your doctor about what you're worried about, you will miss possibly one of the better chances you have at slowing down this disease or freezing it where it's at. So let that be your fear versus what they're gonna take away from you. This disease will take away far more. So. All right, coverage and costs for treatments. Medicare, Medicaid services will cover Leqembi and Consuela with the individual physician enrolls them in a CMS approved registry. Now, what does a registry do? A registry is a research registry, okay? And that allows people to continually to follow the progress of the drug and how it's working or not working, and what we need to be researching and changing about that drug as we continue on. So your doctor can register you as a part of that. If you are somebody that does not want your name in a system, they're not gonna pay for the drugs. You're gonna have to pay for it out of pocket, okay? It's just one of those things at this point. A lot of people don't wanna share their medical things. Right now, we're in a health systems world and we got portals and all this stuff though. So don't let the disease get you just because of that, all right? Try to get on the registry and go take that medicine and get it paid for too. That way you have all that money that you would have had to private pay to actually pay for a nicer place to live as you need more help, okay? All right, again, when you look into the aspect of younger onset and coverage, it is a whole different story, and it is not a good story, guys. It struggles, it's where our holes are right now. It's people that don't qualify for Medicare yet. And private insurances aren't wanting to pay this amount of money for things. And they have a lot of other requirements right now. And I had somebody, a client that went through this exact scenario we've talked about, where they had to had to have the diagnosis, they had to have proof that their doctor was trying a different drug first to show that it truly was needed. And then guess what? Then they could get paid, they could pay for the amyloid PET scan. Then they got that paid for and they got the results and they need Consuela and they qualify for Consuela, but private insurance won't pay for it because they don't feel that necessarily everything else has been tried yet because they've only been through one of the drugs. And you know what that drug was? It was one of the ones for symptoms. It's not for amyloid fighting. And so that understanding and those requirements are what we're fighting for, along with Medicare to pay for the blood tests that you mentioned earlier, because they are not paying for it right now. So there is an act that we have going before Congress. There are several, both in the House of Representatives and in the Senate in DC right now, have sponsors for something called the ASAP Act. Okay, and it's the Alzheimer's Screening and Prevention Act. And it puts us past a hurdle. I don't understand all of how the lawmaking works, I'm not gonna lie. I just go and tell them I want it, all right? But why we have to go in and have our Congress go and jump a hurdle to tell CMS that they can consider now paying for it. Doesn't mean Medicare's gonna have to pay for it or Medicaid, but hey, we're gonna say it's okay if you wanna pay for it. That's what the ASAP Act will do. And so I do wanna encourage you to reach out to your representatives, both congressmen and senators, to say you want the ASAP Act to get through so that we can get to that next step. Because that blood test, it is showing good promise. It's not the only thing that you should use to diagnose though. It's gotta be used in conjunction with other tests too. But it is very helpful, and a primary care physician can order it. It's a matter of getting paid for right now though. You might be out of pocket. But once we have that, you can get earlier diagnosis, right? You can get on that appointment schedule for that specialist or neurologist faster and be waiting now, right? Instead of just starting fresh once you get to the neurologist, so.
I actually had a gerontologist who said he didn't want to give my husband that test
Yeah,
because it might negatively impact his attitude towards aging. Yes,
but can you tell me later who that person was? I might drop in their office and do a little education.
What would you say about someone in their 60s whose parents also got dementia in their 60s, but not showing any signs? Would you get tested if you're not showing any signs?
Do you know what? I used to say no, because unless you are mentally ready to handle the thought in your head that you might get Alzheimer's soon and that you're predisposed to it, don't do it, because it's gonna be mentally challenging for you. And guess what? Just because you have the gene doesn't mean that gene's gonna get activated, guys. That it's gonna activate and you're gonna actually have it. More and more as of late, I have learned a lot more about genetic testing, and it's a very personal decision, y'all. It's a very personal decision, and where I didn't think I would ever be able to handle it, I now want a genetic test done to tell me if I'm predisposed, because I want to plan ahead. Because right now, I'm around this disease every day in and out. For me, planning ahead is what's gonna keep me from fearing this right now. When I have the disease, guys, I'm not gonna know that I need to be afraid of it, all right? But right now, I'm seeing it, I'm seeing the impact, I'm seeing how many people have it. And you know what, if I know I have a plan put together, then right now in my head, that could be settling for me. But it is something very personal that you need to know for sure that you're ready to handle the thought process of if that's gonna ever be in your head all the time, day in and day out. And do you need it to be yet? You can do a lot of planning without knowing too. Okay, just for the what ifs in life. Yeah, absolutely. All right, Alzheimer's Association resources. There's a 24/7 helpline that you can call. Do you know what this helpline does? All right. I used to be an executive director of senior living campuses for assisted living, memory cares, independent living, and watch the whole progression. Do you know that you can actually call this number if you're finding yourself challenged with somebody that has Alzheimer's or dementia, and you can call it at any time of the day or night, and say, oh my gosh, this is happening right now, what on earth do I do? I mean, you're not gonna be able to call the doctor at 11 at night, you know, and what are they gonna do right then? They're not gonna be able to do anything. So you get a person on the phone and they start to tell you right then and there different things to try. Redirection techniques, distraction techniques. You know, they start to brainstorm with you and they stay on the phone with you and they try to help you through that situation. Or they tell you, you know what, this is a dangerous situation right now. And so you need to call emergency services and have somebody come and help you. You know, they help you know if you should, if you want them to. They also have one of the biggest libraries the Alzheimer's Association does for anything Alzheimer's or dementia related. And you can call them up and say, I'd like your librarian to go and check and see if you have anything on how this topic and Alzheimer's or this topic and dementias correlate with each other. I mean, bicycles and Alzheimer's. You wanna just throw something out there, ask them to go and see, do they have bicycles and Alzheimer's? I mean, just random things. And they will be able to pull that data for you or that information for you too. So, we don't all need that, but it's still interesting, I think. ALZ.org, you can find a bunch of training on ALZ.org. A lot of the ones we've already talked about, the healthy living for the brain and body, the 10 signs, warning signs of dementia, and different ways of communicating with people with Alzheimer's, okay, are all on there, and you can go through and do those self-courses, or you can sign up and try to go in for other in-person courses similar to this that they have all over DFW going on. So, support groups are a big deal, guys. However, support groups, you're gonna get so much information, you're gonna be on overload, because everybody in the support group's gonna fall in love with helping you when you show up. And they're all gonna wanna tell you what they did, and what they tried, and what did or didn't work for them, and it's lovely. It can be overwhelming. So take it with a grain of salt, take notes, write it down. You don't need to try every single thing you learn in the support group, okay? But if something sounds good and you wanna go and try it, then hey, you're getting more of an education. But most of all, focus on building a community when you're at these support groups, okay? People that you can text with and call with and say, I'm really struggling tonight and I wanna give up and I don't know what to do with my dad right now. And they will know exactly how you're feeling, okay? People just like in this group, gotta stick together on it, y'all. Too many people shy away from it, and so that means when you all have a commonality, you gotta come together. All right, so I am happy, guys, to do a Q&A. I mean, any other questions y'all have, whether it's on the research or aging or Alzheimer's or dementia or things that you've been struggling with?
A couple of the spots have mentioned 10 signs to look for. What are those?
You know what, it's gonna be different. I don't have one up there, do I? So you wanna look for different changes in routines. I'm not gonna give you the exact 10, but I'll tell you the most common things. Looking in drastic changes in routines in a very short time frame. Mom always gets up and goes for a morning walk, and you know what, she didn't do it and she is saying, I just didn't want to. Now that could be many things, right? Then it happens another day or two in a row and you're like, what is this? You know, you guys gotta start looking at it. Is there an infection? Is there depression? But then hand in hand, all right, is she losing things and not ever finding them? I mean, you can lose the remote control, guys. That's one thing. You can find it, but if you forget what the remote control is and you think that the telephone is the remote control, and you're, well, okay, that is real nowadays, isn't it?
It is a set.
All right, so if you get the gist, at least, then that's a concern, you know, as well. And, you know, forgetting that you have stuff on the stove and it's getting dangerous. There's health and safety things you're starting to see. Getting lost on the roadways and not being able to find your way back when you're driving. And not showing up for appointments and or running late for them and because they didn't remember they had them. Some of those things are normal as one-offs, but when they're frequently happening, then there's a bigger problem going on. You'll diagnosed in, finances. Finances is a big key to look for. I have a client that her doctor never told her that she had dementia, even though it was in the physician notes when I got, when I requested all the records. Never called a family member, never called a POA, never told them. The doctor told me to my face, no, I didn't tell her. And the bankers are the ones that called the family. And the postal worker and an AC repair guy called the police for a wellness check on her at one point, and they called the family. The physician never did. There's some messed up stuff, but it's because of the comfort level, guys. It's a comfort level, it's a stigma, it's not knowing how to direct people, and there's no cure for them to tell them to work towards. So, you'll start to see different signs through that as well. Bankers are some of the biggest ones, I think, and pharmacists. I have a pharmacist in Florida that refers me to people for some reason, and because she runs in and people come back in, just like we just saw you yesterday and talked about this, and now we already gave you that medicine, and so they'll talk to the families too. They'll call the families at times if they have a contact, so, different things like that. Yes, ma'am.
Do all types of, if someone has short-term memory loss, but passes cognitive tests, you mentioned dementia as an umbrella term, is that a form of dementia?
Short-term memory loss?
Yeah.
Oh yeah, absolutely, and so you don't get this, something y'all might not know, everybody probably thinks that this is so strange. Sometimes you don't find out what kind of dementia you have. There is a diagnosis that I see so frequently, and most of the time I see this when somebody's been to their primary care doctor or gerontologist or somebody, but they've never made it to a neurologist. It has dementia unspecified as the diagnosis. And then it will add right after that with behaviors, or it'll have without behaviors. But it'll be dementia unspecified with behaviors or without behaviors, depending on. So sometimes they don't know what kind it is.
So does your organization do any continuing education for like therapists or professionals?
The Alzheimer's Association absolutely does, yes, yes.
Will this, can we get a copy of this emailed to us, or is this
Sure.
on something?
No, we can get it emailed to you. It might be on alz.org as well. I haven't looked recently to see if this one's been put on there or not, but, if you did the sign-up sheet, then we can definitely send out an email to
Can you
you.
pass this around again, and if you did not sign in, just pass it, and
Wait.
I'll email it.
You and then
to
you, I think,
everybody.
have questions too, right? Yes, ma'am.
Is
I signed y'all up.
dementia and Alzheimer's
Oh, I
more
got you.
prevalent in this,
Just pass it.
current time? I know there were others earlier on where people had diseases like this, but is it because we get more information now that we know more about it? We're thinking there are more people with it than there used to be, or is it more prevalent for some
I am
reason?
not smart enough to know the answer to that, because you know what, I could see both sides of it, I've heard both answers to that. I truly have heard both answers to that, that with all of the processed foods, with all of the chemicals, with all of these different agents that we're putting on our bodies, I mean, lotions, guys, are dangerous apparently, I mean, dude, I want my soft skin. So, it's, yes, some lifestyles and some things affect all of our health.
longer, or no? Cause I mean, now people live longer and take medicine for this and cures for cancer, so are there a higher percentage of people in their eighties and nineties?
Could be, there could be, I don't know the answer to that,
I
I'm
have a
sorry.
question. Is diminished vision not a sign of, because you already know you got it?
It can be a common occurrence in aging. And yes, with Alzheimer's or dementia, your eyesight can be affected. A lot of times it will also be combined with macular degeneration or cataracts though at the same time. And it causes an added layer of confusion. All right, it causes an added layer because you can't see well enough to know as clearly what's going on around you. And sometimes you can see out of the sides of your eyes, but not right in the middle. And so if you, one of the common, I can know how people walk now a lot of times, whether there's a cognitive concern. But one of, my old former residents actually would walk like this everywhere she'd go down the hall. Now, she did not have a spine problem, y'all. She didn't, but it's how she could see, it's how she was finding the way out of her eyes, you know? But she was also very devious though, she was so cute. She would steal the silverware and the toilet paper and anything from the dining room she could and take it back to her room and put it between her mattresses. But, so she would always be looking around to the doors to see if anybody was looking.
Can you address how hearing impacts dementia?
Yes, and then we're gonna go to you, cause I know we
Okay.
keep moving on.
Oh, sorry.
That's
Go
okay.
back and go.
So hearing is a big part. Hearing, there is and I don't know the scientific term, guys, I'm not a doctor, but hearing, when you're hearing properly, it works a particular muscle within your brain. And when that muscle is not being worked, it can contribute to cognitive decline. Now, not specifically Alzheimer's, not a specific type, but it can contribute to cognitive decline.
And also from what I've seen from experience is people withdraw because they're not hearing in the group, and then that removing themselves from community, that exacerbates, that literally can trigger.
Not just hearing, just in pure awkwardness and not wanting people to realize something's wrong.
Right.
They wanna fake it and hide it, so they withdraw. And as they withdraw, and this is something I was talking to the ladies about, and this is not an Alzheimer's Association thing, but, it gets awkward to talk to people sometimes when you don't know, like we started out with. And when you're in a church setting, guys, I see a lot of times where the families end up feeling alone, and their church family kind of starts to separate out a little bit. And it's not because they don't love them or care about them, but they don't know how to be around them, and they don't know how to help. And you can help and you can be around them, we just have to teach you how. And that's why I'm glad they have this group going, because that's gonna be a big part of your ministry, you guys, is running towards people suffering from this versus away. Yes, sir, what was yours?
Mine was, right now I'm looking at a lot of research around ABOB and decreasing and or leveling that out, right?
And what was that?
APOB.
Yep.
And that's having, like, distinguishing between vascular and, I don't know, I guess my question would be collaborative healthcare, having multiple physicians working around, or concierge medicine, like when you have a little bit more teamwork and organizations like this working together, they're finding that you can do a lot with a little, right? Like with, for instance, my grandmother has it. She does not have a lot of money, she doesn't have a lot of resources, but they kept her in her home, she wasn't taken out of her primary environment.
Good.
She's not on any medication, but the primary catalyst for a lot of the problems that she has is sleep. She's not able to stay asleep, she's getting up constantly to go to the bathroom, and that's what's.
Oh, it's from needing to go to the bathroom more often?
Yeah.
So that's where I see different things like this too, and I often wonder what, have y'all been to a urologist? Yeah, and anytime, guys, even if you're older, some of you guys are aged here, right?
Right.
Do you feel like? I'm gonna say this, cause right now, I'm a little different age group, so are some of the other people here. But I will tell you right now, if the doctor tells me I don't know what's wrong, you know what I do? Find another doctor. I keep trying to figure out what's wrong, and I see so many seniors stop and figure it's just because I'm old. And no, why would we stop? If you are having an issue like that with your grandmother, and even if she has dementia, that's a comfort thing, and so keep pushing your doctors, advocate for yourself, and don't let it be it's just how it's gonna be, she's just gonna have to go to the bathroom more often. No, that's quality of life, so keep going to it. And yes, having a big team is a big deal. But yeah, I would definitely say that. And then one of the things on the drugs that I didn't cover as much is the the drug right here, you have Rexulti and you have Belsomra. Belsomra is really one that is a newer one for insomnia related, but it's not gonna be because of getting up to use the restroom more frequently. But insomnia is something that we're seeing a lot of with Alzheimer's, and you know, when you're not getting a good night's sleep, are you grumpy the next morning? Okay, so somebody with Alzheimer's or dementia is gonna be grumpy too, and it's gonna create some behaviors. And those behaviors could be agitation, it could be annoyance, it could be I don't wanna do anything, I'm just gonna rest and stay. But the sleep is the most vital thing, so keep pushing to solve that.
And maintaining APOD, are they finding that that's helpful in terms of prevention?
I have no idea, I'm sorry.
Okay.
But definitely call the 800 number that I had up here, or go to alz.org and it'll have the phone number on there too. And call them and ask them, just literally call them and ask them, is that something they're finding helpful?
On the sleep, we asked, they all say, no, we don't have apnea, I sleep through the night, but I don't think that that's necessarily true. I think if you wake up grumpy and you're short-tempered and all this, then your brain didn't do the deep sleep and you didn't detox and you didn't clean out the stuff. So I don't know for sure that a sleep apnea machine is the answer, but is one of the drugs a deep sleep drug or something that's
Well, I mean,
just?
restlessness, right? Some people dream at night and others have nightmares and others just wake up and they go back to sleep. They wake up and they go back to sleep, and it affects everybody a little bit differently. So it's not necessarily apnea that's keeping somebody from having a good night's sleep. It can be a multi-factor. People that have Parkinson's related dementia or Lewy body dementia are more likely gonna have night terrors, which are nightmares, but in the medical world they call them night terrors. And so sometimes we don't know they're happening because it's in their sleep, but it affects their sleep, and other times you'll see a restlessness in the sleep. Another client told me just today that their wife, for the first time with her Parkinson's dementia, actually screamed out in the middle of the night. Because I keep asking him, and he goes, well, sometimes she's restless, and I'm like, do you think she's ever had any hallucinations, or if she wakes up from dreams? And he goes, no, I don't think so. She's otherwise, I mean, she stays asleep, but she screamed out the other night, and he woke up and told her, hey, you're safe, and she went right back to sleep. But that restlessness, moving on to the outcry, it's a sign that she's not getting good sleep, and there's a reason why. And so we want to try different drugs for that and look at the different medications that might be appropriate depending on what you're going through.
Let me take one more question, and if some of y'all need to scoot, we can maybe round it up and. Oh, thank you.
Yeah, anyone needs to sign in still.
Maybe you could stay for just a few more minutes. Okay.
Could I just say, you said lower body dementia?
Louis.
L-E-W. Not lower. I'm here.
Louis, okay, please get a hearing aid.
Thank you.
Because we want that hearing muscle to work so you don't get dementia.
There we go. And one of the things to really check for first is when you think that you have a parent or a loved one that has what they call sudden onset, check with get a urinalysis first. It very possibly a UTI, and not all doctors catch UTIs. So it could be a bladder infection, a UTI, or low sodium, and you really have to go to the hospital if you have low sodium. Magnesium, and it can create really delirium. So it's not. Don't start with neurologists. Start with the sodium and
Basics, like rule out the dementia first. My mom called, not about the remote, the other day, but she called and goes, Jenny, I really have had my first thing memory-wise that's really concerning to me, and I need you to diagnose me. And I was like, I'm not a doctor, but what happened, Mom? I was at church playing dominoes with the crew, and on Tuesdays, and she goes, I noticed that Joan, the guy next to me, kept saying that I'm gonna help Joan out here, and Joan was the person that would play right after him. And she was just like, she realized he said that, and then she's like, but who's Joan? And she goes, I just was like, who's Joan? And I kept thinking he was talking about me, he's gonna help me, but then it didn't make sense because he's after me, so that wouldn't help me. And she doesn't have dementia, y'all, and she she's like, but then Joan, and they all kept saying Joan's name, and they were talking to Joan and about Joan and Joan and Joan, and who's Joan? And then it just suddenly cleared up, and I'm like, oh my gosh, Joan's right across from me at the table, like Joan's the next person. I've known Joan for more than a decade. And she goes, why could I not realize who Joan was? And, and that's scary, right? Cause she realized it, and she knows that my mama had dementia, and so forth, and I said, you know what, Mom, though, you have 4 kidney stones right now, and you're having a procedure next week. I'm like, I am gonna guess that you likely have a kidney infection or a UTI or something going on with this right now. And so you gotta look at what else is going on in your life or in their life, and then get that test done. I'm like, go to Walgreens, get an over-the-counter UTI test, right? Did you miss any of your medicines in the last 24 hours or take them at the wrong time of day? Because Mom, you take your morning meds in the car with you and you put them in your door handle so often, wanting to eat before you take them, and then you forget that they're in your door handle. Well, this truck I have now doesn't have a scoop in the door handle, so I did not leave them in there. She goes, they would have fallen through. But it's just, you gotta look at all of those things. It's a very good point. Don't go straight to it's dementia, guys.
Okay, thank you.
Thank you, guys.
Really helpful.
For coming.
You're so thankful.
Thank you again, Rhonda.
Great.
I have
It's the biggest group we've got.
Really? There's the.
It's the biggest group.
Michael, how are you? How you doing? Good to see you.
Yeah, good. How about you? How's retirement? Yeah. Any more? Okay, yeah, this one with Larry Hurd. That might be totally independent, yeah. Probably. There's other stuff going on. Could be related, but it could be. I think it's the same. Well, we have all sorts of like born racing. Yeah.